Hi mga ka-CSA! I'm back! It's me, Mariah. I've been here last year for my face contouring and now I'm coming back here where I belong in CSA Clinic for my face maintenance follow-up check-up. Alam nyo naman, I've been a lot of trouble this past few months. So, daming kainan. So, dapat nating i-maintain ngayon ang ating face. Medyo tumaba. Pero, kayang-kaya yan ni Doc Contessa. And Doc Contessa is going to introduce to me the newest slimming process. So guys, watch out and wait for it. Mamaya may i-introduce at gagamitin na new product si Dr. Contessa for face contouring. See you a bit!
Good day, everyone. Welcome to the Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. And today, mga ka-CSA, we're so glad that we have with us again a very special person, a special friend of mine. Let's welcome Miss Mariah.
Hi, Doc! I'm
Welcome
glad
back.
to be back.
Right, yan.
It's been a year now.
Yeah.
I'm super busy. I'm
Super,
so sorry.
exactly.
But I'm still beautiful.
Correct.
My
And more
face still
beautiful.
contoured.
More beautiful actually.
Yeah.
Kasi inaabangan natin talaga si Mariah and she's so busy eh. Pag nakita niyo po sa kanyang Instagram, ang dami po niyang mga... Actually, she's all over the world na po yata eh. Marami na po siyang mga, pinupuntahan sa iba't ibang lugar. Yan po.
Mariah-fied worldwide naman.
Exactly. Right now, we're going to have a maintenance treatment for Mariah. Of course, we have treatments na dapat po talaga mini-maintain natin. Kasi our face, as time will pass by, di ba, nagkakaroon ng changes pa rin. So, kasi aging talaga is a natural process that will happen always. And what we do is to reverse the process of aging. Kailangan nagkakaroon tayo ng mga preventions, tapos kailangan mini-maintain natin, tinitreat natin. Kasi itong mga cells natin, tissues natin, buhay yan. So, every day, they go through the process called wear and tear. So, meron pa rin tayong mga treatments na dapat pinapatuloy natin para naman masustain ang youthfulness.
Yes.
Yan. So, always young looking, forever young na po tayo.
Forever young at maliit ang mukha.
And yes, so we're maintaining also a contoured face, a slimmer or smaller face. Actually nga raw kasi nakakabata talaga pag maliit ang mukha. Right?
Lakas maka-artista ma.
Correct. So, we're actually starstruck na rin ako kay Mariah. Right?
Medyo tumaba lang dahil sa tour.
Yun. So, actually...
Sobrang food. Sobrang
sa
daming.
food, yan.
Sobrang indulge
Kasi
sa
whenever
food.
we travel nga naman, we taste different kinds of food. And yan. Ito, sa face natin, of course, we have some fat compartments sa face. So, kailangan pa rin nating i-reduce itong mga fats na to. So, especially sa lower area ng ating mukha, makikita dito yung buccal fat na tinatawag. So, this one tends to bulge. Ito yung nakikita natin. Marami kasi sa atin na parang meron dito na naka-project or forward. Yun yung tinatawag na buccal fat. Tapos, meron din sa ibaba nito, meron tayong mga jowl fat dyan. So, actually, itong area na ito, dapat tina-target natin with treatments. And what we want to do is a non-surgical procedure. Okay? Something na walang hiwa and walang downtime.
Safe.
Right? So, what we've been doing with Mariah before was Ultherapy for contouring the face, slimming the face, lifting, tightening, firming. And also before we were doing injections dito sa Masseter, yung muscle po natin for chewing, we want to slim it also. We make use of our toxin injections. Right now, we have a new product na launch na in our country. Actually, it's approved sa 20 countries all over the world, even in United States. It's also a product for masseter reduction also. So, para po lumiit yung dito sa likod ng ating part ng face. Okay? So, yon ini-inject din po. We will be introducing that to you. And dito dun sa buccal fat na rin, we want to do a so-called mesotherapy combined with ultherapy. We had last time yung dito naman sa submental fat, yung below the chin, parang double chin siya. We made use of a combination, mesotherapy and ultherapy, and it was very effective. So dito, yung concern kasi ni Mariah, kasi lahat tayo, meron tayong buccal fat dito eh. Meron. So we wanted to reduce this para hindi po siya nakabulge. So we'll combine ultherapy with the mesotherapy here. Okay? So the first procedure that I will be doing is the Masseter injection. So right now, we'll introduce a newer type of a neurotoxin which is called Seomin. Okay, this is from Germany actually. Ang difference nito dun sa ibang mga neurotoxins or botulinum toxin, it's pure. It's a pure type of a neurotoxin. Wala po siyang halo. Wala siyang mga ibang derivatives. So nakuha na yung product na specific, nandito na po siya. It has no complexing peptide proteins. Yun po kasi yung doon sa mga ibang ini-inject na toxin. So ito ay pure na. Actually, they have a study on this, a lot of studies, and it doesn't cause any kasi yung iba habang tumatagal sa kaka-inject pala ng mga toxins, nagde-develop daw ng tolerance. Parang hindi na nagiging effective yung ini-inject sa kanila. So with this kind of product, hindi siya nagde-develop ng so-called tolerance. Kasi I had patients before na lagi silang nagpapa-inject, tapos time will come na parang na siya, tolerance na, meron ng resistance, hindi na nag-i-effect. But this one is a newer type of a neurotoxin na effective pa rin, and actually sinasabi na because wala siya nung complexing protein. Ayan, meron tayong bagong produkto.
Bago!
Exactly. So, our center always has the new products na nila-launch dito sa ating bansa. Okay? So, we will show you the actual procedure kung paano natin i-prepare din ito and yung pag-inject. Okay? Ating abangan sa pagbabalik ng CSA Certified Skin Authority. So, we're back mga ka-CSA. So, we have our new product here. It's called Seomin, and we'll be opening the product na. Okay. So actually, there's also a instruction on how to prepare this product. Okay, so it's a botulinum toxin type A. So nandun yung mga white crystals inside. So we make use of the 0.09 sodium chloride, 0.09 or rather 0.9% sodium chloride po. We'll mix this. Okay, I actually already had a prepared one. So normally we mix 2.5 of that and then inject lang po dito sa may vial. But we're not gonna use this as an injector, okay? Hindi ito. Pang mix lang po ng ating solution. Yeah, it's a big needle, but this is not the one we're gonna use. So after that, we actually mix the product. Okay. So, kailangan pong ma-dissolve yung powder, yung crystal doon sa ating saline. And then, aspirate lang tayo. So, we've been using, like for example, sa Masseter ni Mariah, we've been using for her like around 50 units to 80 units. That was in the past.
Saka, Doc, iyan ba same lang na parang after a while, dun gumaganda? Yung parang as time
passes by.
Oo.
Okay.
Kasi ako napansin ko, like maganda na siya on the spot. Parang, pero kapag after patagal ng patagal, dun lumiliit.
Mas lumiliit, exactly. Actually, the work of botulinum toxin, they take effect 8 days to 15 days. Okay? And then, dun mo makikita yung pag-slim ng muscle, yung dun sa face mo.
Pero kahit years, maliit pa rin siya.
Yeah. For Mariah, really, she really exemplified yung nagtatagal yung effect nitong mga injections sa kanya eh. And I think your lifestyle is also a healthy lifestyle na rin, di ba? Eating healthy diet, healthy living, exactly. So we have a preparation here. Okay, it's a 40-unit preparation. Now, they really had a study also daw. Pag madalas mong ginagawa ang ganitong injections, there will come a time na yung effect niya mas tumatagal na. Yes. So, yung masseter muscle mo, it can be relaxed. So, pagkapanay mong pinapagwa, like every 6 months, you do it. And then, like after 2 years, pwedeng next time, once a year ka na lang. Or, hindi na mag-overgrow yung muscle, or hindi na siya yung tinatawag namin mag-hypertrophy or mag-enlarge masyado. Okay? So, yun yung tinatawag nating maintenance treatment. So, the more you do it, then the next time, lesser na yung pag-enlarge ng ating masseter muscle. Okay? Kasi these are muscles we use for chewing. So, of course, muscles, they grow when you use them, right?
Yeah.
Like yung mga bodybuilders. So, they want to have deltoids, biceps. The more they work out, the more na lumalaki yung muscles. So, with the chewing muscle, yun nga, the more na nag-chew or nagngunguya, syempre you exercise the muscle, the more the muscle will enlarge. But then, yes, that's one thing. That's why we tell our patients kung ayaw nilang masyadong lumaki na yung masseter nila, yung mga pagngunguya, yung mga nuts,
iwasan ng
chewing gum, mahilig mag-chewing gum, or yung mga chichirya, or yung mga matitigas na food. Yan, we love kasi eating steak or meat, so medyo matigas. The more we chew, okay? Yeah. So, same thing, the technique kasi, like if you make a marker, kindly hold this first. Yung ating marker pa rin, okay? So, from the tragus of the ear to the corner of the mouth. And then we palpate for the masseter, the belly of the masseter, okay, here. And then we can make 3-point injection here. So, ganong technique pa rin, the basic technique that we use. Okay, I'll change my gloves muna. So, here we actually wanted to be careful in our treatment. So, asepsis, antisepsis is important. Okay. But these injections kasi, actually, they can be done in office lang ng mga doctors So, we're not doing surgery naman. So, we still wanted to be careful. Okay. So, I have here a cotton soaked in an alcohol. Okay, 3-point injection. Bite, please. Okay, inject lang doon and then aspirate and then push the medicine. We'll make 3-point injection here. Okay. And then bite. Then relax. So actually, there was also a study na they also use the Botox or the toxins or like Xeomin. Yung iba kasi ang problem, yung parotid gland. Malaki din yung parotid gland. Then there was a study also na ginagamit ang ganitong produkto para lumiit ang parotid gland. Yung parotid gland natin yung nandito sa side or harap ng ating ears. Okay, so we're done with the 3-point injection. Okay. So everything should be balanced. We have to do the other side, of course. So we're done with the right masseter. Okay, so in the right masseter, I won't do any more drawings. Okay. Because usually we do that for purposes of demonstration to our doctors whom we train. So we just move to the other side, yung ating left masseter. Sometimes we ask our patients, saan ka ba madalas magnguya? So like si Mariah, most of the time is the right side. The cotton with alcohol, please. So most of the time yun yung mas malaking side. Okay, bite. Just make them bite and then relax. Kasi you can feel the muscle already when they do the biting. Okay. And then for doctors, you have to avoid yung risorius muscle here. Okay, because that muscle is pulling the corner of the mouth. Doon siya nag-smile. Now, if you hit the risorius muscle, the corner of the mouth will go down. So for doctors, you have to avoid the risorius because the risorius is attached on the belly of the masseter. So may mga nag-i-inject na hindi doktor, they don't know that. That's why you have to be very careful. Okay? Kaya minsan may mga iba na when they inject Botox on the masseter, bakit biglang yung isang side na pag-smile bumaba? So be careful. There are important structures here that we have to avoid. Those are no-go area or danger areas. Okay? So, importante yon, Mariah. Okay, bite. Kasi we've been hearing or there are reports na minsan may mga non-doctors injecting. And we doctors keep on studying and we always, of course, follow what are the safe techniques. And
basta-basta dapat.
Exactly. Okay? So, merong parotid gland dito, tas ito yung masseter, may platysma muscles dito. So, tas may zygomatic major muscle doon. Kailangan na-avoid yon. Okay? Bite again, please. Okay. And then relax. Okay. After this procedure, we just do ice compress lang dun sa area na na-injekan po. And then some of my patients, first 3 days pa lang may nakikita ng resulta with the injection of the toxin. So we're done with the toxin injection. What's the next procedure to do para mag-slim pa yung lower face ni Mariah? It will be the Ulthera na. I will be doing Ulthera, more of this anterior part kung saan ako nag-inject. I won't be targeting the Masseter anymore. Because I don't wanna have the Ulthera heat touch the Botox or the toxin product because there's heat from the Ultherapy. Okay? So we'll do Ultherapy plus the Mesotherapy sa pagbabalik ng CSA Certified Skin Authority. Okay, we're back. So, ating ipinagpapatuloy ang treatment. So, more of the face slimming, face contouring, and of course, rejuvenation at the same time. So, we're here with our Ultherapy machine. I really love our Ulthera because it has done amazing things. And totally safe, okay? And I think this one kasi for me, it has no downtime talaga. So, I can do this now and go back to my work. So, I still have my handpiece here plus the transducer. The transducer has a 4.5 millimeter, okay? So, ang target ko kay Mariah right now will be this part ng kanyang lower face. So, I did injection kanina dito. I won't touch that because I don't want the heat from the Ulthera to touch the material, the product we have injected. So, right now, we're targeting the anterior part, mostly the buccal part area kung saan yung may bulges, okay? Now, we have an X mark here. We have to avoid that. Why? Because there's this branch, this mandibular branch na nerve dito. Okay? So, marginal mandibular branch, we have to avoid that. So, for the doctors who are doing this, ito po yung iniiwasan. Okay? So, we'll be targeting this part here. So, the transducer. And then, we press the scan. I like it because meron siyang visualization ng mga tissue layers. For example, here, i-check ko yung kanyang buccal area here. Okay. So, lines that you see, parang dun sa ultrasound natin, when we do ultrasound, we do imaging ng mga tissue sa loob. So, you will see mga layers, epidermis, dermis, and the subcutaneous fat. So, ang target kasi nito is the fat layer. We want to reduce also the fat layer. And then, below the fat layer, meron siyang konting muscle fiber. You want to tighten it. Magko-contract po yon. So, okay? So, press lang yung button here. And then, we'll target yung dito sa may buccal fat area. Okay, 4.5 millimeter. Pinatarget niya yung tinatawag na SMAS layer above the SMAS. Okay, first shot lang po. And how was that?
Good.
Okay lang. Can you describe yung sensation, Mariah?
Para kang kinikiliti.
Okay. For some days ay parang ticklish eh. Okay. Nung ako kasi, ang sensation ko, parang tiny pricks na merong heat. Yeah.
Ako lang parang kang kinikiliti.
Yan. Meron din kasi siya ng heat, certain temperature for coagulation necrosis ng mga fat cells. Okay. So that temperature will help in also what we call yung sa cellular fat, matarget din niya.
Mainit siya na.
Yes. Para mag-dissolve din yung mga fats na yon. And at the same time, naaabot yung dermis layer para dun sa fiber formation ng yung mga collagen synthesis, yan. So, nare-restore yung natural protein fiber, yung natural elasticity ng skin. So, magkakaroon ng lifting, tightening, firming from within. So, this kind of procedure, actually, you can do it during your coffee break or lunch break from your work.
No downtime.
Exactly.
Is it safe, Doc, kung lagi-lagi or may time talaga na when, gano'n?
Yeah. Magandang tanong yan. Kasi ito kasi, you can do one-time treatment in a year. Like you do full face and the neck area, minsan, you can do it. Pero pwede rin kasi siyang i-divide into sessions.
Yan. Kasi minsan, yung iba kasi tumataba na, so kailangan na.
Yeah.
Diba?
If there's a need, then do it.
Oo. It doesn't mean necessary na parang 1 year talaga.
Yeah,
dapat, diba?
exactly.
Pag nafe-feel mo na medyo, kailangan i-maintain na.
Maintain. Then, you can do it.
Like
Okay.
for me, diba? Sobrang
Yeah.
out of the country.
Yes,
So I gain a lot.
Yes,
Dami
yes.
kong, dami
Right.
kasi masarap yung pagkain, diba?
Correct, yes. Of course, when you go to other countries, don't deprive yourself naman.
Oo nga eh.
So it's also good when you travel, you do this. And the good thing, we have machines like this. Kahit nag-gain ka, you can do the treatment
Oo.
again.
Tsaka,
Right.
hindi ka takot kasi non-surgical siya.
Correct, yeah. This one, actually, they will be having another set of ambassadors for the Philippines. I think they will show them to us kasi they did an awarding last time, and CSA was one of the awardees during that event, the Tala Award. And we're grateful to MERS for that recognition. Sa ating, thank you. Yeah, thank you so much. Thank you. Yes. Of course, everything. We just want to give the best for our clients as much as possible. Kung ano yung pinaka-safe and effective, of course.
Effective.
Correct. Supported by scientific studies. Yun ang importante. Meron silang mga clinical studies. Okay? And actually, when we attend congresses or conferences, we always discuss the results of these procedures. So, lagi tayong nagpapa-update.
Lately nga, I saw you in Korea, diba?
Yeah,
You did
we
some
had-
seminar ba?
Yeah, we had Korea, yan. Tapos, we also go Thailand, Singapore.
Kasi medyo
yan.
nauuso nga yung mga Korean look eh. So,
Exactly. Korean shape of face, V-shape, Korean skin. So, the Koreans were really right now, I think, sa kanila yung all over the world, nagtatop sila sa industry na ito.
aesthetic beauty.
Yes, yes. And they really innovate, ang tawag dito, marami silang innovations.
Oo nga eh.
Even itong mga devices. Although this one, this Ultera kasi is a USA device. Okay, so I did the 60 shots on the right side, and we'll do the other 60 shots on the left, and then after that, we'll be giving the mesotherapy.
Wow, mukhang
Okay.
mukha ko nito, madam. Ano na?
Yeah. It's best to do combination. Kasi for the combination, you see the results dahil iba't ibang layer ang tinatarget natin. So we wanted something for the fat, we wanted something for the muscle, we wanted something for the skin, and the skin has epidermis, dermis, subdermis, or subcutaneous fat. So, lahat ng tissue layers of the face should be targeted. Right? And then normally after the treatment, we do a balance check also. We tell our patients to come back like after a week or two para makita if there's symmetry. It's important na maging symmetrical tayo. Kasi beauty is balance. Beauty is symmetrical. Okay? And also sa face natin, dapat laging positive look. Kasi minsan may mga negative expressions making us look angry. Yung iba so tired or haggard looking. With procedures like this, you can reverse those looks. Yung mga expressions ng pagiging parang yung mga tiger look ang tawag doon. You can correct them with injections. Meron tayong mga toxin injections, filler injections, or even yung mga threads natin na galing ng Korea. And machines like this, devices like this. So lahat ngayon pwede na pong ma-treat. So we're almost done with our Ultherapy. Last shot. And then let's do the meso injection. So the meso injection is just a quick injection. So right now we will proceed with the face line injection. Ito po yung pinaka mesotherapy natin. So I will be targeting the buccal fat area here. So the purpose of this one is to dissolve the fatty tissues that we have here on the side of our mouth. Okay, I'll just pinch, so clean the skin, and then pinch, and then this part here, aspirate, and then inject the product. Okay. So you can do 3 to 4 sessions of this 1 week interval. Okay, that's half. Okay, tolerable. Yeah, and last one here. Kasi this part is the one with the fatty tissue kasi. Okay, so I'm so sorry. Yeah, medyo sometimes the mesotherapy has some form of discomfort because of the product that we're injecting. So I'll do the other side.
Okay naman.
Yeah, it's actually, we can tolerate this just to help also the fatty tissues.
And
the other side.
remember, real doctor should do it.
Exactly. So this one here, I'm just pinching, palpating for the ano. Parang mas bulge ka dito compared dito.
Hindi masyado dito.
Right. So less lang tayo dito. I'll just do one injection here. And I'll probably give the other half on that side with. I'll divide into 2 injections. Okay, be careful here because there's this so-called facial vessel here that forces this part, okay? It's located deep into this part from the mandibular notch. Okay, I'll add more here kasi mas bulge siya dito, okay? You can also give for the nasolabial fat fold here. Okay. So after this, we'll just do ice compress na lang. So we're done. We're done with the procedure. Pwede pa siyang pa-facial actually kasi Mariah needs some maintenance skincare. Okay, para po yung mga pimple marks also. Okay? So, thank you so much, Mariah.
Thank you so much, Doc. Yeah. You're the only one I trust when it comes to my face.
Thank you. Yan. So, we will be doing ice compress already. So, yan. Okay, Mariah. So, any message to our
guys?
CSA?
Okay. Mga ka-CSA, you know what? I've been with Doc for almost 10 years. Decade.
Yeah.
Decade. And before we started, madami ako. Super laki ng face ko.
Yes.
And then, when I started to go to Doc, sabi niya, analyze natin.
Dry.
And then after na-analyze yung face ko, kahit gaano ako magpapayat, pumayat ang katawan ko, yung mukha ko hindi. So, isa lang ang nag-iisang nakapagpaliit ng aking mukha. And then, actually, Doc doesn't stop there eh. Kasi she always introduce some new product na much effective actually. So ito na naman, may bago na naman si Doc na tinry sa atin, which is safe. So guys, makikita nyo in the next few mga days ba, Doc?
Yes, few days.
Effect.
Right.
Guys,
try natin.
Try nyo to, especially those brides na medyo may problema sa medyo biggy face. Try nyo to. It's non-surgical.
Thank you.
So, it's safe.
True.
Tsaka, remember ha, punta lang kayo sa trusted doctors.
Exactly,
Kasi it might, imbis na gumanda,
Right.
maruin yung mukha.
Yes.
Alam mo naman, investment natin ang mukha.
Correct. So, we're also concerned with the people. Ito, Mariah, mirror para makita mo na.
Diba?
Oo. Concerned din kami kasi dun sa mga tao na nagkaroon ng problem, okay? Kasi usually problem occurs whenever you don't go to talagang mga trusted doctors.
Correct.
Po talaga. We're so many, mga aesthetic doctors, aesthetic dermatologists, aesthetic surgeons. So we know what we're doing and we have studied this for a long time and we continue to still study po. Okay? We always have conventions, conferences all over the world. Hindi lang po tayo sa Pilipinas. We talk to other doctors from other parts of the world. Ayan, maraming salamat, Mariah.
Thank
you,
Doc.
Abangan pa po natin siya sa kanyang mga follow-ups.
Tingnan nyo na lang.
Yes
Follow my
po.
IG for follow-up.
Right. So, kung meron po kayong katanungan, email us at csaskinclinic@yahoo.com. Ang aming clinic po ay matatagpuan dito sa 2nd floor Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0933-860-9193 or 0917-504-4268. Meron po akong Instagram, doc_contessa, ang aking FB, CSA Derm Centre, or yung FB page, CSA Derm Centre pa rin po. And my personal FB, Contessa Salvador Alapag. Marami po kasi kaming mga messages, punong-puno po lagi. And sorry po pag hindi po namin kayo nasasagot. Please be patient with us. Punong-puno na po kasi talaga and we get people to reply you. And also, we cannot do consultations po online. Yun lang po sana pakiusap. Basic questions lang po. Kasi ang dami pong mga tanong na konsulta na po. And every day po, we have a lot of patients here. And of course, we have to attend to them first. So, please po, wala po ng online consultation. Yung mga basic tanong na lang po.
Punta na lang
po.
kayo.
And kung pa-assess po, pwede naman para magka-idea lang po
Visit,
kayo kung magkano yung procedure. Okay, salamat po for your understanding. Thank you so much. And of course, I would like to thank MERS for giving us the MERS Portfolio Award recently lang po.
Yeah.
Thank you for that recognition. Thank you. To God be the glory po.
Yeah.
O, ayan. Thank you so much. Salamat sa aking mga
Congrats,
assist.
Doc. You
Sandra.
deserve
And,
it.
yes. and Jen. And thank you sa inyong pong lahat. God bless you all. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.